What if I told you that one of the most powerful tools for managing your blood sugar isn't sitting in a prescription bottle? What if it's something as simple and as completely overlooked as when and how you drink water? I know how that sounds. You're probably thinking, I've been drinking water my entire life. How could that possibly help my diabetes? Or maybe you're skeptical because you've tried so many things that promised results and never delivered. Supplements that didn't work, diets that felt impossible to maintain, advice that sounded good but never translated into better numbers. Stay with me, because what I'm about to share has made a genuine, measurable difference for hundreds of my patients. People who were doing everything right and still struggling. I'm Dr. Julian Cross, cardiothoracic surgeon, 30 years in medicine. And in all those years, one pattern I've seen consistently across thousands of patients is this: the most powerful interventions are rarely the most complicated ones. Sometimes it's the basics we've completely overlooked that create the biggest, measurable differences. Today, I'm going to show you exactly how proper hydration timing can improve your insulin sensitivity by up to 40%. Not hypothetical cases from textbooks, real people in their 60s and 70s, taking their medications faithfully, following meal plans carefully, measuring portions, checking blood sugar multiple times a day, walking every morning, and still, their numbers are unpredictable. Still, they feel exhausted. Still, they worry every time their A1C results come back. The frustration I witness in my practice is real. These are individuals who've been fighting this battle for years, sometimes decades. They've done everything their doctors asked, and they're tired. Tired of the constant vigilance. Tired of feeling like they're failing, even when they're trying harder than anyone around them. The key isn't just how much water you drink. It's when you drink it, how you drink it, and what you add to it. Small, strategic changes in timing can create substantial improvements in blood sugar control. Let me show you exactly how. Let me start by explaining what's happening inside your body as you age, because understanding this makes everything else make complete sense. After 60, several significant physiological changes occur that make blood sugar control genuinely more challenging, even when you're doing everything right. First, your cells gradually become more resistant to insulin. They don't respond as quickly or efficiently when insulin tries to deliver glucose into them for energy. Second, your pancreas doesn't produce insulin as efficiently as it used to. You're working with less of this crucial hormone circulating in your system. Third, your kidneys don't filter glucose as effectively. Excess sugar lingers in your bloodstream longer instead of being eliminated. And here is the part most people, including many healthcare providers, completely miss. Your brain's thirst mechanism becomes significantly less sensitive with age. That last point is critical. You can be substantially dehydrated, even dangerously dehydrated, without feeling thirsty at all. Your mouth might not feel dry. You might not experience any obvious discomfort. But inside your body, at the cellular level, things are going wrong. Even mild dehydration, just 2% below optimal hydration levels, can raise your blood sugar by 10 to 15 points. That's enough to take you from good control to poor control. That's enough to explain those frustrating morning spikes or unexpected afternoon highs that seem to come from absolutely nowhere. Let me tell you about a patient I'll call Gerald. He was 68 years old, and I could see the frustration written across his face before he even sat down. "Dr. Cross, I don't understand what I'm doing wrong." His voice was tight with emotion. "I'm eating carefully, measuring everything. I take my metformin exactly as prescribed. I walk 3 miles every single morning. I've completely cut out sugar and white bread. I've done everything I've been told to do." He pulled out a small notebook filled with blood sugar readings. Some mornings it's 145, other mornings it's 185. Yesterday 162, this morning 178. Same breakfast every single day, same steel-cut oatmeal, same measured portion. but the numbers are all over the place. His wife added quietly from beside him, "He tries so incredibly hard, but his A1C has crept up from 7.1 to 7.9 over the past year." We went methodically through his entire routine. Diet, excellent. Medication timing, perfect. Exercise, completely consistent. Everything looked right on paper. Then I asked what seemed like an almost trivial question. "Gerald, walk me through your morning routine from the moment you wake up until breakfast." I get up around 6:30, check my blood sugar, make coffee, drink my coffee while reading the news. Then around 7:30, I make my oatmeal and take my medication with a glass of water. "When do you drink plain water?" I asked. He paused. "When I'm thirsty, I suppose. Sometimes with my pills. Is that wrong?" There it was. Gerald went from 6:30 a.m. until 7:30, or later, before drinking any actual water. 8 hours sleeping without fluids. Then another full hour awake without hydrating. 9 hours of progressive dehydration before his first meal. We made simple, strategic changes. Every morning before his coffee, warm water with a small pinch of sea salt and fresh lemon juice. 15 minutes before lunch and dinner, a glass of room temperature water. A reusable bottle to sip consistently throughout the day. 2 weeks later, he called my office. His voice sounded completely different, lighter, almost excited. My morning readings have been between 125 and 138 for the past week, every single day. That consistency hasn't happened in over 2 years. A month later, his average fasting glucose had dropped by 22 points. No medication changes whatsoever, just water, timed correctly and consumed strategically. "I honestly thought you were a little crazy," he admitted at his follow-up. "Water seemed way too simple to actually matter, but I can't argue with my glucose meter." Before I teach you the specific method, let me explain the 3 most common hydration mistakes I see in my practice. You're almost certainly making at least one of these right now. Mistake number 1, waiting until you're thirsty to drink. Thirst isn't an early warning system. It's an alarm bell that goes off only after you're already significantly dehydrated. By the time your mouth feels dry, your blood has already thickened, your glucose levels have already elevated, and your insulin is already struggling to work efficiently. Think of your blood as a river carrying glucose to your cells throughout your body. When that river is full and flowing well, glucose moves smoothly to where it needs to go. When the river runs low, it becomes thick, sluggish, slow-moving. Glucose gets stuck. It accumulates in your bloodstream instead of being delivered to the cells that need it. Mistake number 2, drinking large amounts all at once. Some people go hours without any water, then suddenly drink a huge glass trying to catch up. But your body can only absorb approximately 200 to 250 milliliters every 15 minutes, about 1 cup. Anything beyond that just passes straight through to your bladder without hydrating your cells at all. Think of watering a houseplant. Dump an entire bucket on it at once. Most of it runs off the sides and the roots stay dry. Water it slowly and steadily. The soil absorbs it and the roots get exactly what they need. Same principle, same body. Mistake number 3, drinking ice-cold water, especially in the morning or right before meals. Cold water feels refreshing. I understand the appeal, but ice-cold water causes your blood vessels to constrict and narrow. When your vessels narrow, insulin has a significantly harder time reaching the cells that need it. Room temperature or slightly warm water keeps your blood vessels naturally relaxed and open, allowing insulin to circulate and work far more efficiently. This is especially critical in the morning and around meal times when your body is actively processing glucose. Now let me teach you the specific method I use with my patients. I call it the H3 method. H stands for hydration. The first 3 represents 3 key timing points throughout your day. The second 3 represents 3 essential elements that make this approach work. Let's start with the timing points. Timing point number 1, first thing in the morning. This is the single most important timing point of the entire day. The moment you wake up, before coffee, before breakfast, before checking your phone, Drink 1 full glass of warm water, about 350 milliliters, roughly 12 ounces. Here's the crucial addition. Add a tiny pinch of natural sea salt. I mean genuinely tiny, just what fits on the tip of a butter knife. And squeeze in the juice of about half a fresh lemon. Why these specific additions? After 8 hours of sleep, your body isn't just dehydrated from lack of water. You've also lost electrolytes through normal nighttime processes. That small amount of sea salt provides sodium, potassium, and magnesium, minerals that help your cells actually absorb and utilize the water you're drinking, instead of it simply passing through. The lemon provides vitamin C and creates a slight acidity that helps stabilize your body's blood sugar response to your first meal of the day. This simple morning ritual accomplishes something remarkable. It signals your adrenal glands to calm down. Those glands naturally produce cortisol, your stress hormone, which peaks every morning. Cortisol instructs your liver to release stored glucose into your bloodstream. By calming this stress response with proper hydration and minerals, you actually prevent that unnecessary morning blood sugar spike. Let me share another patient's experience. Eleanor was 72, had been managing type 2 diabetes for 14 years, and her biggest ongoing frustration was her morning blood sugar. She'd wake up consistently at 165 or 175, even though she'd eaten a careful dinner and her bedtime reading had been perfectly acceptable. We started with just this one single change: warm water with a small pinch of sea salt and fresh lemon juice, first thing every morning, at least 20 minutes before her coffee. 3 weeks later, her average morning reading had dropped to 128. Same medication, same evening routine. The only difference was how she started each day. "I wake up feeling genuinely different," she told me at her follow-up, "more clear-headed, less foggy, and that lower morning number gives me confidence for the entire day." Timing point number 2, before meals. About 15 minutes before lunch and dinner, drink a smaller glass of water, about 150 to 200 milliliters, 1 cup. This simple habit does something physiologically important. It prepares your digestive system, stimulates enzyme production, and, most importantly for blood sugar management, it slightly dilutes the contents of your stomach. This directly slows down how rapidly carbohydrates are absorbed into your bloodstream. When carbohydrates enter your bloodstream slowly and gradually, instead of all at once in a rush, your available insulin can actually keep up with the demand. Your blood sugar rises gently and steadily instead of spiking sharply. Clinical studies have demonstrated this simple habit can reduce post-meal blood sugar spikes by up to 20%. That is often the difference between struggling with control and maintaining genuinely good management. Timing point number 3, during physical activity. If you walk, garden, do household chores, or engage in any sustained physical activity for more than 20 minutes, you need to drink water during that activity, not just afterward when you're already depleted. Aim for approximately 100 to 120 milliliters every 15 minutes of sustained activity. Small, frequent sips rather than large gulps. This consistent hydration keeps your blood volume stable and prevents the blood sugar fluctuations that commonly occur with physical exertion in people managing diabetes. Now, the second 3 in the H3 method, the 3 essential elements that make this approach work. Element number 1, temperature matters. Room temperature or slightly warm water is optimal, especially first thing in the morning and before meals. Around 22 to 24 degrees Celsius, roughly 72 to 75 degrees Fahrenheit. Warm water keeps your blood vessels naturally relaxed and open, allowing dramatically better insulin circulation and delivery. A seemingly small difference that compounds significantly over time. Element number 2, minerals matter. Pure water alone is not sufficient. Your cells require minerals to absorb and utilize water effectively. That small pinch of sea salt in your morning water provides those essential minerals. Natural sea salt contains sodium, potassium, and magnesium in proper balance. Avoid regular processed table salt. It's been stripped of these vital trace minerals. Choose unrefined sea salt or Himalayan pink salt that still contains the full mineral spectrum your body genuinely needs. Element number 3. Timing consistency matters. Your body thrives on predictable routine. Drinking water at consistent times every single day helps regulate your entire metabolic system. Morning water at the same time. Pre-meal water at regular intervals. This consistency directly helps stabilize blood sugar patterns over time. One more addition I consistently recommend. About 1 hour before bed, drink one final glass of warm water with 200 milligrams of magnesium citrate or magnesium glycinate dissolved into it. Magnesium is absolutely critical for proper insulin function. The vast majority of people over 60 are clinically deficient in it. Taking it before sleep serves a dual purpose. It helps your muscles relax for deeper, more restorative sleep, and it keeps your blood sugar significantly more stable throughout the night. Everyone asks this question: "Doctor, how much water should I actually be drinking each day?" Here is a simple, practical formula. Take your current body weight in pounds and divide that number by 2. That resulting number, in ounces, is your baseline daily water intake. If you weigh 160 pounds, you need approximately 80 ounces daily, roughly 10 standard cups. If you exercise regularly or spend time in warm weather, add 1 additional cup for every 20 minutes of physical activity or heat exposure. How do you know if you're drinking enough? Look at your urine color. It should be pale yellow, similar to lemonade, not completely clear, which signals overhydration, not dark yellow or amber, which signals dehydration. Pale yellow is the optimal target. Practical implementation. Get a reusable water bottle that holds approximately 24 ounces. Fill it completely 3 times throughout the day, morning, midday, and afternoon. That's 72 ounces, perfect for most adults. Keep that bottle constantly visible, on your kitchen counter, on your desk, in your car. Visual reminders work far better than trying to remember on your own. Here is what to realistically expect when you begin this method. Week 1. You'll likely feel like you're visiting the bathroom constantly. This is completely normal. Your body is simply adjusting to proper hydration levels. It settles down significantly by week 2. You should notice your morning blood sugar beginning to stabilize, maybe 10 to 15 points lower on average. Not a dramatic overnight transformation, but consistent, measurable improvement. Weeks 2 to 3. Noticeably more stable energy throughout the day. Less of that frustrating afternoon energy crash. Post-meal blood sugar readings becoming substantially more predictable. Week 4. If you check your A1C, you may see it beginning to trend downward. Not necessarily a large drop immediately, but clear movement in the right direction. And here's what I hear most often from patients. "Dr. Cross, I just feel genuinely better. I can't quite explain it precisely, but I feel more like my old self again." That's what proper hydration creates. It doesn't cure diabetes. It doesn't replace medication, but it helps your body work the way it was designed to. Let me tell you about Dorothy. She was 74 when I first met her, managing diabetes for 19 years, multiple medications, various restrictive diets, diabetes education classes. She understood carbohydrate counting better than most registered nutritionists, but her A1C had been steadily climbing. It was now 8.6. Her endocrinologist was seriously discussing starting insulin therapy. "I feel like I've completely failed," she told me quietly, her voice breaking. "I've done absolutely everything right for 19 years, but my body just keeps getting worse. Maybe this is simply what happens. Maybe I can't fight it anymore." Her hydration habits were poor, maybe 3 or 4 small glasses of water a day, coffee in the morning, tea in the afternoon, but actual plain water, very little. "I never feel thirsty," she explained, "and honestly, I hate using the bathroom constantly when I'm out with friends." We started the H3 method together. Yes, for the first week, she'd need the bathroom more frequently. I told her clearly that her body would adjust within 10 to 14 days. 6 weeks later, she looked noticeably different when she walked into my office. Eyes brighter, skin healthier, actually smiling. My numbers have been the best they've been in 5 years, she said, showing me her glucose log. My average used to hover around 185 to 205. Now I'm consistently 145 to 165. My doctor actually reduced one of my medications. But she said it wasn't just about the numbers. I have genuine energy again. I can think clearly without that constant fog. I even started gardening again, something I'd given up 2 years ago. 3 months later, her A1C came back at 7.3, down from 8.6. "You gave me my life back," she said, tears on her face, but happy tears. With water, something that costs virtually nothing. I just wish someone had explained this to me 19 years ago when I was first diagnosed. Dorothy's story is exactly why I make videos like this. Because there are thousands of people exactly like her right now, trying so hard, feeling completely defeated, when sometimes the answer is genuinely simpler than anyone could imagine. Let me be absolutely clear about something critical. This is not a replacement for proper medical care. If you're taking diabetes medication, do not stop. If your doctor has you following a specific management plan, continue following it. What this hydration method does is support your existing medication, making it work more efficiently in your body. If you have any degree of kidney disease, talk to your physician before substantially increasing water intake. For most people, this approach is completely safe. But if your kidneys aren't filtering properly, you need individualized professional guidance first. If you're on blood pressure medication, pay close attention as you increase hydration. Proper hydration can naturally lower blood pressure, which is generally beneficial, but may require medication dosage adjustments. Watch for any dizziness and report it to your doctor. Here is my challenge to you personally. Try this approach for 14 days, just 2 weeks. Follow the H3 method exactly as I've outlined it. Morning water with sea salt and lemon, first thing upon waking. Water 15 minutes before lunch and dinner. Proper daily water intake spread consistently throughout the day. Magnesium water before bed. Track your blood sugar carefully during those 2 weeks. See for yourself if the numbers improve. Pay genuine attention to how you feel. More sustained energy, clearer thinking, better sleep. If after 2 weeks you observe real improvement, keep going. Make this your permanent new normal. Leave a comment below telling me what you noticed. Your personal story may be exactly what another person desperately needs to hear to give this method a serious try. And tell me, what is your biggest struggle with staying hydrated? I read every single comment, every one. If this information was helpful to you, share it. Send it to someone who is struggling with their blood sugar, a parent, a spouse, a close friend. This is the kind of information that should not stay locked behind a doctor's appointment. Subscribe if you haven't already, and bring someone you care about along with you. There is a great deal more to cover on this channel. I'm Dr. Julian Cross, and I'll see you in the next video. One last thing. Everything I've shared today is general information based on current research and clinical experience. It is not personalized medical advice for your specific situation. Your history, your current medications, your other conditions, all of these matter enormously in calibrating the right approach for you. Before making any changes to your treatment plan, please have a real, informed conversation with your own physician. They are your partner in this. Small, strategic changes, implemented consistently, create genuinely measurable results over time. Take care of yourselves. I'm Dr. Julian Cross, and I'll see you next week.